Retigabine or Izogabine. Retigabine is a potassium channel opener and is a third-line treatment for focal seizure. Because retigabine causes pigment discoloration of the retina and skin, its use is limited to those who have failed to respond to other agents. It means that retigabine is not the only anti-seizure drugs, but there is also gabapentin, tiagabine, and lamotrigine, and others. And then this retigabine, uh, on, only patients who are not who are failed in their treatment to other anti-seizure drugs only use can only use this. And then this retigabine was approved by FDA last June 2011. Mechanism of action. So retigabine is an allosteric opener of KCNQ2-5 voltage-gated potassium channels which are localized in part in axons and nerve terminals. Opening KCNQ potassium channels in presynaptic terminals inhibits the release of various neurotransmitters, including glutamate, which may be responsible for the seizure protection. So as you can see in the screen, the two pictures, the first picture is a closed KCNQ2 channel in a hyperexcitable state, while the second picture in an open KCNQ2 channel in retigabine binding. So you can see the difference. There's they're changing structures there, where retigabine activation of KCNQ channels modulates the M current, which is important for excitability of neurons. So that is the mechanism of action of retigabine. Next is clinical use. So doses of retigabine range from 600 to 1,200 mg deciliter, with 900 mg deciliter expected to be the most common. And the drug is administered in 3 divided dose, and the dose must be titrated beginning at 300 mg. Most adverse effects are dose-related and include dizziness, somnolence or drowsiness, blurred vision, confusion, and dysarthria. Urinary symptoms including retention, hesitation, and dysuria or speech or dysuria or kaning painful urination believed to be due to effects of the drugs on KCNQ potassium channels in the detrusor smooth muscle. Kanang responsible or the muscle is the component of our urinary bladder and facilitates the contraction of bladder wall during our micturition or kanang manghihita. So they are generally mild and usually do not require drug discontinuation. Pharmacokinetics. Uh, Absorption of retigabine is not affected by food, and kinetics are linear. And then drugs interaction are minimal. And then the major metabolic pathway in humans are N-glucuronidation and N-acetylation, which mainly takes place in our liver. Then the drug neither inhibits nor induces the major CYP enzymes involved in our drug metabolism. So that's all, and thank you.